Yes. इसको सेव उसे तो कैसे करना पड़ेगा? इसमें कुछ प्रॉब्लम है, इसको सेव ओल्ड मेथड से करना पड़ेगा। तो 17 कर पाओगे? यस। नेक्स्ट देखने को लगे। नेक्स्ट स्टडी है, देखो ये एलिगेशन होगा। नेक्स्ट स्टडी है किसी की, ये वाली पीडीएफ। यस सर, ये कर लो। तब तक इसको करो। तब तक इसको कर लो आप। So PDF only first. Start here. Here. Ready. So next we have a presentation by the MBBS student on double murder case. Let's say is prepared it from the media news. So Navpreet and Arushi.
Behavior is the language of trauma. Children will speak to you before they'll tell you that they are in distress. With this, a very warm good afternoon to everybody. Distress, a word usually misinterpreted, usually connected to psychological distress, and that too with children. But what we usually tend to forget that children are not alone. There's a whole family behind the children. Any distress to a kid will lead to catastrophic events in the family of the child. And that's what we are going to discuss today in our presentation. Please note that all the facts given in this presentation are latest as per the news reports and nothing has been made up.
The Budaun double murder case is a tragic incident that occurred in March 2024 in Budaun, Uttar Pradesh, India. The victims were two children, Ayush and Ahan, 12 and 8 years old respectively, who were attacked by Sajid, a barber, who ran a shop across from their home. A third child, Yuvraj, was also attacked but survived with serious injuries.
What you're seeing on the screen now are pictures of the victims, Ayush, who was 12 years old, and Ahan, who was 8 years old. They're standing with their mother and their middlemost brother, who was 10 years old at the time of incident. Below them, what you're able to see are the images of the accused, Sergeant, who actually fled from the incident and was killed in an encounter by the police in a nearby forest. And standing next to him is his brother Javed. Javed has yet surrendered, but there has been no acquisition on Javed yet.
Case elaboration. The two young brothers were murdered on Tuesday evening in Baba Colony, Budaun, Uttar Pradesh. Accused Sajid committed the atrocity around 7:30 p.m. on the terrace, entering the house under the guise of borrowing rupees 5,000 from the victim's father, Vinod Singh, as stated by Budaun SSP Alok Priyadarshi.
The accused sergeant's wife was pregnant at the time, and he used that for a reason to enter the family of the victims to get 5,000 rupees for the delivery of her wife's children. The victim's family has named Sergeant's brother Javed in the FIR as well. As already mentioned, he has yet surrendered. The double murder case part a lot of problem in the nearby colony, due to which police protection was given. So Arushi, this was all about the overview of case. Now let's move on to the police investigations and the encounter, how it all went on.
As a part of the police investigation and encounter, the murder weapon and the revolver used by Sajid have been recovered by the police. After the murders, Sajid attempted to flee but was chased by the police and killed in an encounter when he opened fire. The motive remains unclear. So reports suggest a possible monetary dispute.
Sajid's brother Javed has yet told to police that Sajid, since birth, had some sort of psychological issue due to which his anger was uncontrollable. But as the police has killed Sajid in an encounter, there has yet been no evidences regarding it. The police have detained the father and uncle of the accused, Sajid, for questioning. Heavy police has been deployed in the area, as already mentioned.
Now, this was the overview of the case. Let's move on to the forensic implications, starting with the autopsy finding. So first, Ayush, on external examination, multiple incised wounds on the forearms indicated defensive injuries. Deep stab wounds to the chest and abdomen caused significant internal bleeding. On internal examination, penetrating injuries to the lungs and liver leading to hemothorax and hemoperitoneum were found. The cause of death was determined to be hemorrhagic shock due to multiple stab wounds.
It was dreadful to find out on examination that the elder brother Ayush was stabbed 14 times, whereas the younger brother was stabbed 9 times, with a total of 23 stab wounds in the case. That's miserable to hear that such small children were stabbed 23 times, and a few of those stabs were actually on the same site as the primary stab, which means there has been a big conflict between the victim and the accused families. Moving on to the autopsy finding of Ahan, who was 8 years old and younger brother, his external examinations revealed several deep incised wounds on the chest and back. There was no defensive wound noted as it was in case of his elder brother, suggesting that a sudden and overwhelming attack was done on the younger brother, due to which he was unable to protect himself. Internal examinations revealed severe damage to the heart and major blood vessels due to the attacks on back of the chest and front of the chest.
Other tests besides autopsy findings that could have been included are the toxicological studies and psychiatric analysis of the accused. But these couldn't be performed since the accused Sajid was already killed in the encounter, as already discussed.
So what are the related sections to it, Arushi? We have discussed the case scenario. We have given an overview of how the police did encounter of these and how all the investigations were performed. How was the autopsy performed? So now let's move on to the related sections. How were these accused punished? So we know BNS, the Bharatiya Nyaya Samhita, has replaced IPC, Indian Penal Code, and the sections under which the accused were to be punished are as follows. BNS 101, the section which defines murder. BNS 102, which is culpable homicide. As we know that the intention of Sajid was to kill the elder brother. He had 2 more younger brothers. The second younger brother reached at the incident as was killed just by the conversation that he was having with the elder brother. When he killed him, the younger brother saw him and he was also killed in the incident. That's why BNS 101 and 102 are both applicable here. Murder and culpable homicide. When we move on to BNS 103, which is punishment for murder, it could be either lifetime imprisonment and even a death sentence in case of homicide. When we talk about BNS section 109, which is attempt to murder, we knew that there were 3 brothers who were the victims of Sajid. The eldermost brother was killed, the younger-most brother was killed, but the middle-most brother, he survived. He had injuries at the back of his neck, but he survived, due to which we had BNS section 109 applicable in this case, which is attempt to murder. Then moving to BNS section 3 with subsections 5 and 6. The subsection 5 defines acts done by several persons in furthermost of common intention, and subsection 6 defines when such an act is criminal by reason, or if it's done with a criminal knowledge or intention, the person shall be punished.
Moving on to BNSS, that is Bharatiya Nagrik Suraksha Samhita, which was earlier called as the CRPC, that is a Criminal Procedure Code. So the BNSS sections that could have been applied to the investigation of this case were information in cognizable cases, that is BNSS 173, recording of confessions and statements, BNSS 183, report of police officer on completion of investigation, BNSS 193.
Here, just for our representational purposes, we have images of the weapon used and the type of injuries that can be listed. The type of weapon used was a sharp cutting weapon, which was a knife used for stabbing the brothers. You can see on the right side of the image, we have image of stab wound, but please be cautious. This stab wound is from a weapon which is sharp on both the edges, whereas in this case, the stab was done by a knife which was sharp at one edge and blunt on one edge. So we'll be getting a wedge-shaped wound, which will be sharp at one edge and flat on the other edges. So this was the case where the forensic doctors performed their duties well, the police officers performed their duties well, but due to the case that there was an encounter by the police of the main person who attempted and did the murder, the case is still open. There has been no conclusion on the case yet. But what happens when the mistake is by the side of the doctor, or if the family of the victim considers that the mistake is by the side of doctor? Our coming presentation will elicit such cases. Thank you.
So now I'll call upon Vedahi for her next presentation.
Good afternoon, everyone. Today, I, Vedi, MBBS third year, part 1 student, is going to discuss a case regarding the topic mismanagement of the previous LSCS leading to uterine rupture, maternal and neonatal mortality. So basically, what exactly the case is about? It is about the mismanagement lead to a uterine rupture, which lead to emergency of LSCS. What is LSCS? It is the lower segment cesarean section. This lead to both the mother and the baby expired during the surgery. It was later revealed that the patient's delivery was handled by the doctor with only an MBBS degree. Further on, moving on the case description, the patient about whom we are talking is Mrs. X, who is 33-year-old woman with a past history of a lower segment cesarean section, which is LSCS, and hypothyroidism. Was admitted to an urban private hospital at 40 weeks, 5 days for delivery at term. She was discharged by Dr. A with an instruction to return for follow-up after a few days or upon the spontaneous onset of labor, with a plan of VBAC. VBAC is the vaginal birth after cesarean. The point to be noted here is Dr. A and Dr. D are just MBBS graduates, while Dr. C and D are MBBS graduate with qualified obstetricians. The patient was readmitted at 41 weeks despite of clinical findings suggesting of the cephalopelvic disproportion, which is CPD. Labor was induced with prostaglandin E2 gel under Dr. A's instruction, who was just a MBBS graduate. During the rounds, Dr. C and D identified CPD and informed Dr. A, but Dr. A disregarded and their concern and ordered the augmentation of labor with oxytocin, while Dr. B, who was also just an MBBS graduate, was on duty and oxytocin was delivered at 5 units per 24 drops. When signs of obstructed labor were emerged, still Dr. A, who advised continued oxytocin for another 2 hours. After 2 hours, signs of scar dehiscence, uterine rupture, and fetal distress were recorded. A decision was made to proceed with LSCS, but there was a significant delay in its execution. After approximately 40 minutes, LSCS was still not performed and the patient began to experience giddiness, difficulty breathing, and signs of shock. Tragically, a stillborn baby weighing 4.06 kg was delivered. The patient had severe uterine rupture, bleeding, adhesion, and despite efforts of the operation theatre, she could not be stabilized and expired. Now, further moving on the decisions. The decision made by the State Medical Council. The observation, first of all, which they made were, the first observation was that primary risk factor with the patient's history of the previous LSCS, a pregnancy that was post-dated by 9 days, and the presence of CPD, VBAC, which is the vaginal birth after cesarean, should not have been attempted in this case, given the twofold increase in the risk of LSCS scar rupture. The second observation made was the vaginal birth should have only been initiated after obtaining comprehensive consent, including for cesarean section. The third observation, the induction of labor was poorly monitored and appropriate response to emerging signs of distress were not made. Based upon the following observation, the SMC Council concluded that Dr. A name was to be removed from the medical register for 3 months and a fine of 10,000 to be imposed for the violation of the Code of Medical Ethics. Dr. B was also fined with rupees 10,000. Dr. C name was removed from medical register for 3 months and Dr. D name was removed from the medical register for 6 months. Further on, all these doctors appealed to the Ethics and Medical Registration Board. The doctor approached and the EMRB made the following observation. The first observation, the patient had a history of previous cesarean section, was known to an hypothyroidism and was carrying post-dated pregnancy with a baby weighing 4.06 kg. Also, presenting part of the baby were noted to be above the pelvic brim during the several pelvic examinations, suggesting CPD. Given these conditions, VBAC should have been avoided. The second observation, there was a clear failure of the recognizing signs of scars, dehiscence, and uterine rupture in this case, leading to maternal and neonatal mortality. Both the Dr. A and Dr. B held only MBBS degree and they were therefore not qualified to manage such a high-risk patients. The third observation, one of the most important observations, a prudent obstetrician would not have discharged the patient near the expected date of delivery, that is EDD, and would not have waited for a spontaneous onset of labor well beyond the EDD if labor was to be induced for VBAC. The last ultrasound was performed at 38 weeks and labor was induced almost 3 weeks later. A prudent obstetrician would have considered performing an ultrasound before induction to assess fetal well-being. Now, in the view of these observations, EMRT of the National Medical Commission made the following decision. First of all, the SMC were directed to remove the names of Dr. A and Dr. B from State Medical Register for a period of 1 year. Dr. C and Dr. D were issued warning to exercise greater care in future. Moving on further, now we need to discuss about the case. As seen in the case, the doctor had been very negligent with the patient. So what exactly negligence is? It is when a medical professional fails to exercise reasonable care and skill which result in harm to a patient. It can be act of commission or omission. In India, medical negligence can be of 2 types. First of all, the civil negligence. No specific and clear violation of law, simply absence of care and skills. Criminal negligence must have specifically violated a particular law. It is a gross negligence or a lack of competence. Now, 7.20 of Indian Medical Council Regulation 2002 states a physician should not claim to be a specialist unless he has a special qualification in that branch, which was violated by Dr. A and Dr. B. Now, the Consumer Protection Act can also be included in this because medical profession is as a service provider. And the definition of service according to CPA of 2019 is inclusive and only excludes the services, free services and personal services. The services that are free but are paid by other patients are included in CPA. So this can be come under Consumer Protection Act. The conclusion of this case, which could be derived, is this case underscores the importance of the adhering of the professional conduct, etiquette, and ethic regulations set by the NMC. It highlights the need of a proper delegation of duties and appropriate clinical decision made with informed consent and ensuring that the patient was fully aware about their case. The tragic outcome of this case served as a stark reminder of the consequences of medical negligence, violation of code of ethics, and the critical need for stringent adherence of the professional standards in medical practices. The take-home message regarding this case, first of all, the Bolam test. It is a legal standard used to assess medical negligence. A significant delay in performing the emergency LSCS after signs of fetal distress, a uterine rupture clearly indicates that these conditions does not meet the Bolam standards, as most responsible obstetrician would not consider this practice acceptable. The second, FOGSI Good Clinical Practice Guidelines 2024 clearly indicates that the management of only high risk and complicated cases should be done under supervision of qualified specialists. Thank you so much for hearing me out.
Thank you, Vedhi, for the presentation. Now I would like to call the next presenters, Mannat and Muskan Sharma, who will present their case concerning vicarious liability in healthcare. So there's one more after this. One more. Okay.
And my case.
Good afternoon, everyone. So our topic is vicarious liability in healthcare, the consequences of unqualified practitioners on the patient safety. So start करने से पहले मैं एक छोटी सी स्टोरी बताऊंगी जो कि ये पूरे केस की ब्रीफिंग होगी. तो देयर इज अ 30-year-old वुमन, वो आई है हमारे पास नहीं किसी और हॉस्पिटल में, और उन्होंने मेडिकल अबॉर्शन किया. बट आफ्टर अल्ट्रासोनोग्राफी हमें पता चला है कि उसमें रिटेन पार्टिकल्स रह गए हैं, रिटेन प्रोडक्ट ऑफ कंसेप्शन. तो उनको बोला कि आपकी डीएनसी हो जाएगी, विच इज अ सर्जिकल प्रोसीजर. अब एक गायनेकोलॉजिस्ट एंड एनेस्थेसियोलॉजिस्ट अपॉइंटेड है, बट जिस दिन डीएनसी होनी है उस दिन गायनेकोलॉजिस्ट अवेलेबल नहीं है. तो गायनेकोलॉजिस्ट ने क्या किया, किसी और बंदे को बोल दिया कि आप प्लीज मेरी जगह पे प्रोसीजर कर दो, जो कि हॉस्पिटल का बात है. अब डीएनसी परफॉर्म हो गई है, 24 आवर्स के अंदर ही उनको उन्होंने जाने दिया क्योंकि वाइटल स्टेबल थे. नेक्स्ट डे क्या हुआ, नेक्स्ट डे बहुत ही ज्यादा ब्लीडिंग एंड वॉमिटिंग आनी स्टार्ट हो गई. लेडी ने हॉस्पिटल को कांटेक्ट किया एंड हॉस्पिटल वालों ने कहा कि आप आ जाइए, हम देखते हैं. उन्होंने देखा पेशेंट वॉज क्रिटिकल. एक प्राइवेट हॉस्पिटल से दूसरे प्राइवेट हॉस्पिटल में उन्होंने रेफर कर दिया. पेशेंट इतना वेल ऑफ नहीं था, वहां पे जाके फिर भी उन्होंने यूएसजी करवाई और वहां पे हमें पता चला कि यूट्रस में परफोरेशंस थी अलोंग विद द बबल में भी परफोरेशन थी. तो उन्होंने कहा कि फिर से सर्जरी होगी एंड काफी ज्यादा खर्चा आएगा, तो गवर्नमेंट सेटअप ने उनको फिर से रेफर कर दिया. पेशेंट को ठीक होने में 1 महीना लग गया. द मोमेंट पेशेंट ठीक हुआ, पेशेंट ने केस कर दिया अगेंस्ट द हॉस्पिटल, जो सबसे पहला जहां पे उनका ट्रीटमेंट हुआ था. तो अभी जल्दी से एक बार केस देखेंगे.
A 30-year-old female patient took medication from a medical abortion, which resulted in the incomplete abortion. Despite the procedure, she continued to experience persistent vaginal bleeding and was subsequently referred to ultrasonography. The USG conducted at a private hospital revealed retained products of conception. She was advised to undergo dilatation and curettage (DNC) and was admitted to the same hospital for the procedure. The hospital managed to qualified physician Dr. X employed a gynecologist and anesthetist on the part-time basis. On the day of scheduled DNC, the gynecologist was unavailable and sent a colleague to perform the procedure. The DNC conducted by the colleague and the patient who was stable at the time was discharged the same day. The following day, the patient began experiencing vomiting and severe recurrent vaginal bleeding. She contacted the hospital by phone and was advised to return the next day. Upon her visit the next day, in the deteriorated condition, she was referred to another private hospital where subsequent USG revealed perforations in the uterus and bowel loops. Due to financial constraints, she was referred to a government tertiary care center for further treatment and remained hospitalized for 1 month undergoing various procedures. The patient filed complaints with the police and the state medical council alleging negligence by the private hospital where the initial DNC was performed. An inquiry revealed that the individual who performed the procedure was not a qualified medical professional and was posing as a doctor with a fraudulent degree. The hospital had allowed this individual to perform the procedure without verifying their credentials. Now we will discuss the decision of State Medical Council. इतने सारे arguments और जो भी both parties की देखने के बाद they concluded that कि जो भी extensive morbidity हुई थी, that was basically experienced by the patient. That was the direct result of the procedure that was performed by an unqualified individual that was appointed by that practitioner. अब उसके बाद क्या हुआ, ये सब चीज को देखते हुए they classified it as an criminal negligence. अब जो unqualified person है that was found liable for the punishment under various provisions of IPC, which is 337, section 337, and now it is BNS section 125 subsection A and section 127 section 27 of the State Medical Council Act 1997. उसके बाद जो डॉक्टर एक्स जो कि ओनर था उस प्राइवेट हॉस्पिटल का, that was found guilty of based on her vicarious responsibility, and उसका her name was removed by the state medical register for 15 days, who failed to verify the credentials of the person जिसने procedure को किया था. उसके बाद जो एक warning दी गई थी to both the gynecologist and anesthetist जिसने जो कि DNC procedure में involved थे. Now we come to decision on ethics and medical registration board, जो कि जिसको मैं अब ERM भी बोलूंगी. आफ्टर दैट कि जो ओनर था जिसने जो स्टेट मेडिकल काउंसिल की तरफ से डिसीजन आया था, उसने क्या किया कि वो ERMB के पास ले गया. बट आफ्टर ऑल द रिव्यूइंग द सबमिशंस और मेडिकल रिकॉर्ड्स को एग्जामिन करने के बाद दे डिसाइडेड टू अपहोल्ड द SM स्टेट मेडिकल काउंसिल्स डिसीजन. नाउ वी विल डिस्कस द होल केस इन अ वेरी शॉर्ट वे. जो प्रोसीजर परफॉर्म किया गया था बाय द अनक्वालिफाइड इंडिविजुअल, वो सीधा रिजल्ट किया इनटू द यूट्राइन परफोरेशन बाउल इंजरी ऑफ द पेशेंट. एंड हॉस्पिटल का जो ओनर है उसने सबसे बड़ी गलती है कि दैट शी फेल्ड टू वेरीफाई द क्रेडेंशियल्स ऑफ द पर्सन परफॉर्मिंग द सर्जरी, which is significantly stated as administrative lapse. उसके बाद क्या है, हम MTP एक्ट डिस्कस करेंगे जिसका सेक्शन 5 सबसे इंपॉर्टेंट है, जो कि क्लियरली स्टेट करता है कि टर्मिनेशन ऑफ द प्रेगनेंसी डन बाय अ पर्सन हु इज नॉट अ रजिस्टर्ड मेडिकल प्रैक्टिशनर shall be a punishable offense with rigorous imprisonment for a term which shall not be less than 2 years but which may extend to 7 years. जिसको हम serious और this calls for serious criminal charges and people associated them can also be considered abetting the offense under this act. उसके बाद जो qualified doctors थे involved in this were found guilty associating with an unqualified person in a violation of regulation 1.6 of Indian Medical Council regulation 2002, which is highest quality assurance in patient care. उसके बाद जो भी every physician, इसमें जो कहा गया है कि every physician should aid in safeguarding the profession against the admission to it of those who are deficient in moral character or education. जो physician shall not employ or allow unqualified person to attend, treat or perform operations upon patients. जो further ये code 7.9 है, ये बताता है कि performing or enabling unqualified person to perform an abortion or any illegal operation for which there is no medical, surgical or psychological indication. Additionally, जो consent डीएनसी प्रोसीजर में लिया गया था एंड एनेस्थीसिया का लिया गया था, उसमें काफी सारी डिफिशियंसीज थी, जैसे कि जो डिटेल थी पोटेंशियल कॉम्प्लिकेशन की अबाउट द प्रोसीजर वाज नॉट क्लियर. उसमें ना ही टाइप ऑफ एनेस्थीसिया जो यूज है उसका बताया गया था, ना ही नेम ऑफ द सर्जन एनेस्थेटिस्ट बताए गए थे. फर्दर मोर उसको काउंटर साइन भी नहीं किया था डॉक्टर ने. आगे मेरी जो मेट है वो आपको टेक होम मैसेज बताएगी.
तो टेक होम मैसेज बेसिकली 4 हेडिंग्स के अंदर है, जल्दी जल्दी खत्म करेंगे, बहुत लंबा हो गया. तो क्रिमिनल ऑफेंस के अंदर दिस केस हाइलाइट्स द सेवरल लीगल कॉन्सिक्वेंसेस फॉर वायलेटिंग द प्रोविजंस ऑफ द एमटीपी एक्ट 1971 amended in 2021 and underscores the importance of ensuring that only qualified and registered medical practitioners should perform the medical procedures, specifically if it is related to pregnancy termination. Civil medical negligence के अंदर a person is held liable at the law for the consequences of his negligence. Credential verification के अंदर always ensure that any procedure, especially surgical ones like DNC, is performed by a qualified medical practitioner. And informed consent. In this case, जो एनेस्थीसिया वाला था उसने कहीं भी बिल्कुल भी अच्छी तरह से नहीं बताया था what is the procedure by which they are going to give the anesthesia. So, performing a surgery without obtaining a real consent constitutes an unauthorized invasion and interference with the patient's body. Thank you very much.
Thank you, Muskan and Mannat, for the wonderful presentation. Now, for the next speaker, I would like to invite Anandita Sethi and Japneet Kaur on the stage.
Dr. K.M. Keith once said, "People are often unreasonable, irrational, and self-centered. Forgive them anyway."
If you're kind, people may accuse you of selfish ulterior motives. Be kind anyway. Today, I, Anandita,
And I, Japneet, are here for a case presentation on the topic allegations of improper cardiac procedures performed without consent, leading to patient's death. Keywords: mitral stenosis, tricuspid regurgitation, rheumatic heart disease, criminal medical negligence. Context: patient care. Abstract. Mrs. M, a 43-year-old female, was admitted to the emergency department of a private medical hospital in a metropolitan city with complaints of breathlessness, along with swelling in both lower limbs and the abdomen. An echocardiogram revealed severe mitral stenosis, tricuspid regurgitation, severe pulmonary hypertension, and mild ventricular dysfunction. Based on these findings, an elective surgery was planned and the patient underwent the operation to address these conditions. However, 10 days post-surgery, Mrs. M experienced hypotension, which progressed to multi-organ failure, leading to her demise. According to the family, there was no known history of cardiac or other significant illnesses, nor any previous surgical procedures. The family alleges that a thorough cardiac evaluation was not conducted, noting that an ECG was not performed upon admission. They further claim that the severity of the cardiac condition, pre-surgical counseling, and potential complications were not adequately communicated. Additionally, the patient's husband asserts that Mrs. M had gallstone disease, which was not addressed during her hospital stay. Here, the husband levies allegations on the doctor in a court scene.
The case summary is Mrs. M, a 43-year-old female, was admitted to the emergency department of a private hospital at 11 p.m. with complaints of breathlessness lasting for 2 hours, along with progressively worsening swelling in both the lower limbs and abdomen over the previous 2 to 3 days. According to her medical records, she had a history of rheumatic heart disease, for which she underwent a surgical procedure called commissurotomy in 1993 to relieve narrowing of the mitral valve. Additionally, she had undergone balloon mitral valvuloplasty in 1997. Despite these interventions, Mrs. M continued to experience recurrent episodes of congestive heart failure in the past. Now I'll depict you what is mitral stenosis and tricuspid regurgitation. So here I'm depicting tricuspid valve regurgitation. It's a type of heart valve disease that occurs when the leaf valvulets do not close properly. So here the blood is leaking back into the right atrium. This is what we call as mitral valve stenosis. Mitral valve stenosis is characterized by the narrowing of opening of mitral valve of the heart. As you can see here, the mitral valve of the heart is narrowed here. It is almost caused by rheumatic heart disease. Normally, the mitral valve is about 5 centimeters square during diastole. Any disease in area below 2 centimeters square causes mitral stenosis. Now, I depict you balloon mitral valvuloplasty. In this procedure, a catheter with a balloon on the tip is inserted into the blood vessel to the groin and then threaded through the mitral valve. The balloon is then inflated to stretch the valve and improves blood flow through the heart and body, as it can reduce the pressure in the heart and the lungs. The following day, Mrs. M was transferred to the cardiothoracic and vascular surgery intensive care unit. An echocardiogram revealed severe mitral stenosis, severe tricuspid regurgitation, severe pulmonary hypertension, mild left ventricular dysfunction, and at last, right ventricular systolic dysfunction. There were tremendous abnormalities in such patients. Doppler studies in the lower limbs and carotid arteries were performed. Both yielded normal results. And at last, a coronary angiography was also conducted, which showed no significant abnormalities. After these investigations, Mrs. M was assessed by anesthetist for her fitness for surgery. Informed consent was obtained. Prognosis was explained well to her family members. 3 days after admission, Mrs. M underwent mitral valve replacement and tricuspid valve repair.
On the first two post-operative days, Mrs. M remained hemodynamically stable with the support of inotropic medications and mechanical ventilation. However, on the third post-operative day, she experienced a drop in blood pressure. Suspecting intrapericardial bleeding, she was promptly taken back to the operating theatre where a pericardial clot was removed. A post-operative echocardiogram confirmed the normal functioning of both prosthetic valves. On the fourth post-operative day, Mrs. M was successfully weaned off the ventilator and extubated. However, 2 days later, she developed respiratory distress and required re-intubation. Unfortunately, Mrs. M's condition continued to deteriorate, leading to further hypotension and multi-organ failure. Unfortunately, Mrs. M could not be revived. Aggrieved by the death of his wife, the husband filed a police complaint against the treating doctors. As required by the law, the police sought a medical opinion from the State Medical Council before filing an FIR.
So as we all saw that you can't just simply lodge an FIR, you have to get the opinion of State Medical Council before filing an FIR. So what was the decision of State Medical Council? After reviewing all the medical records, the State Medical Council concluded that the patient's death, while unfortunate, was not due to medical negligence. It was attributed to her underlying medical conditions. Based on these findings, State Medical Council determined that there was no prima facie case of medical negligence. So what is prima facie case? It's a legal term that refers to situations where a judge reviews pre-trial evidence and finds it sufficient to warrant a trial. It falls under section 173 of BNS. Then decision of Ethical and Medical Review Board. The EMRB conducted a thorough review of the case. After careful consideration, the board found no deficiency to the patient and thus decided to uphold the decision of SMC. So what they discussed? The Bolam test is a legal standard used to assess whether a medical profession has provided an appropriate level of care in the treatment of patient. According to this principle, a doctor is not considered negligent if their actions are in line with the practice accepted as proper by a responsible body of medical professionals skilled in that particular field, even if the professionals might hold a different opinion. So applying the Bolam test to this case, the patient had a 25-year history of valvular heart disease, including severe mitral stenosis, severe pulmonary hypertension, right ventricular dysfunction. These conditions made her a high-risk candidate for the valve replacement surgery. The decision not to perform simultaneous surgery for the gallstones was informed by the significant risks associated with this surgery. And according to the Bolam test, the choice to focus solely on the life-threatening cardiac condition rather than addressing the gallstones, this approach would be deemed appropriate as it aligns with the standard of care that competent professionals would apply in similar circumstances. The patient's consent for the valve replacement surgery was obtained. अगर उन्होंने इस केस में कंसेंट नहीं लिया होता, तो then it would fall under section 106 of Bharatiya Nyaya Sanhita. It states that whoever causes death of any person by doing any negligent act not amounting to culpable homicide shall be punished with imprisonment of either description for a term which may extend to 5 years and shall also be liable to fine. If such act is done by a registered medical practitioner while performing medical procedure, he shall be punished with imprisonment of either description for a term which may extend to 2 years and shall also be liable to a fine. So by applying the Bolam test, the decisions made by treating doctors, including proceeding with surgery, not managing the gallstones, obtaining informed consent, the overall treatment strategy was consistent with what a reasonable body of medical professionals would consider acceptable. Therefore, SMC and EMRB's determination that there were no medical negligence.
Take-home message. In the landmark case of Kusum Sharma and others versus Batra Hospital and Medical Research Center, the Supreme Court of India deliberated on the standards of medical negligence. It emphasized that a medical professional would not be held negligent if they acted in accordance with a practice accepted as proper by a responsible body of medical professionals. An error of judgment by a doctor, if made in good faith and in reasonable skill and care, does not constitute negligence. In case of Jacob Matthew versus State of Punjab and others, the Supreme Court of India addressed the issue of medical negligence, particularly in the context of criminal liability for medical professionals. The Apex Court suggested that in cases of alleged criminal negligence, the investigating officer should obtain an independent and competent medical opinion before proceeding with FIRs. Thank you.
Thank you, Japneet and Anandita, for the informative presentation. Now, after this round of wonderful presentations, I would like our honorable dignitaries to come and felicitate the participants. Please, Dr. R.K. Goria, sir, Dr. Pradeep Singh, sir, Dr. Akhilesh Pathak, sir, Dr. Yadukul, sir, and Dr. Pramod Goyal, sir. Please come on the stage. Please, can we have a round of applause for our dignitaries?
Yes, sir. So कहाँ पर है? Download. Yes.
Hello. Good afternoon, everyone. Now we have come to a stage where we are going to announce from the UG and PG session who is going to take the first prize, second prize, and third one and appreciation. And before that, we are distributing the certificates and declaring from the PG section who will be the number one or first one. Can you have all the guests? ये पीजी स्टूडेंट बैठे हैं, किसी को है आइडिया? Okay, now I am going to declare Dr. Teresa James. She is the first one. First prize to go to her. All the presentations that are presented by UG and PG students, they are wonderful and informative. But she scored well than her contendant. So congratulations to her. The second prize for the PG student goes to Dr. Chandrakala, please. And in the UG section, the competition was somewhat tough because we are expecting only 2 presentations, but we have got a 4. So we are starting from 4th one. Can you have got any guess who will be the 4th one? क्यों अच्छा नहीं किया आपने यार? Okay, now 4th one is Japanese and Nandita. And third prize that will go to Mannat and Muskan. And for selecting second position and first position, that was also difficult for all of us being as judges, and we should have to declare it. And the second one is with a and last one, and happy birthday for her. And two names are there. That is Napri Singh and Urushi. First one. So they are also the anchors. So big congrats to all of you. Congrats to all the presenters. Before we will end this session, and I would like to request Dr. Bhuria sir, who is the president of the Society for Prevention of Injuries and Corporal Punishment, to say a few words for this conference that we have enjoyed and academic feast we all have witnessed here from morning till now. And that was a wonderful experience for all of us. Now I will give the mic to Gauri.
This one. You can use either. Okay.